Hello, I'm Dr. Geeta Baruah Nath. I'm Senior Consultant of Gynae Department, Artemis Health Institute. Today I would like to tell you something about cervical cancer. Cervical cancer is one of the leading cause of death among women in India and worldwide. Now, how to prevent it? Most importantly, almost 100% you can prevent it. It is fortunately nature gives us like 10 to 15 years of time after you get that virus called human papilloma virus, which you get through sexually transmitted disease. Now, human papilloma virus has almost 100 strains, but out of that, only few strains, like 4 of them, are more virulent, which causes cancer. Now, this virus is normally sexually transmitted. Who gets it? Usually, if you are exposed to sex very early in life, or you have multiple sexual partners, either you or your husband or your partner, and also in immunodeficiency conditions like people who are already having infections or HIV or any other immunological disorders, or many other conditions like that. Now, how to prevent it? Prevention is you have to maintain a good hygiene, good balanced diet, exercise to keep up with your immunity, and also maintain a good regular lifestyle, avoid multiple sex partners, and also in case of any symptoms like any watery discharge, foul smelling discharge, in between intermittent menstrual bleeding or itching, continuous infection, you should report to the gynecologist immediately. Prevention in diagnostic test, Pap smear is very important to prevent cervical cancer, because Pap smear is one test which is very simple. It can be done in the OPD, yet it is very inexpensive and very informative. Almost 80 to 85% is almost informative about Pap smear. Rest we can also combine with a test called human papilloma virus test, which is not required every year, but once at least one must do to know if you already have the virus inside. Now, having a human papilloma virus does not mean you have the cancer cervix already, but many young girls like below 30, they can have HPV virus inside you, but that doesn't mean they will have cervical cancer infection, definitely, but sometimes it goes away on its own. If it persists, then it can cause turn into cervical cancer. Now, to prevent, you have to have regular health checkups at least once a year. If 3 consecutive Pap smears are normal, then you can have once in 3 years Pap smear as well. And HPV DNA test, if it is not, if it is negative, then you don't have to repeat it again and again. But to prevent, most importantly, in India now we have cervical cancer vaccinations available. Now, who should take the vaccination? Ideally, before the girl is exposed to sexual life, then you should take the cervical cancer vaccination. Especially from the age of 9 to 13 is the ideal age according to the book. But in India, you can take up to the 17-18 years of life. Otherwise, it's not necessary that only the girl who is not exposed to sex, only she can take it. Married people or people who are sexually active, they can also take it up to the age of 45. These vaccinations are against 4 main strains of virus, and there are 3 doses of it. First dose, then after 1 month, second dose, and after 6 months, third dose comes. Now, if you are vaccinated, that does not mean you will not get the disease at all, but at least you will be protected against the main strains of virus. Even if you are vaccinated, you must come for regular checkups once a year, or after 3 consecutive smears, maybe once in 3 years, but definitely one must go for regular checkups to prevent the disease, because once you know precancerous level, when the carcinoma in situ is there, if you detect at that time, you are 100% you can be cured. The operation is done and you are cured. You don't even need any other treatment. But if you delay it, already you are having the cervical cancer, still it can be cured, but depending on the stage of the disease. I think prevention is better than cure, so come for a regular checkup, and it's very inexpensive. Once a year you come for the checkup and lead a very healthy, normal life.
I think that covers most